Hello, my name is Ananya Kumar, and this summer I worked on formulating thermosensitive radiopaque hydrogel for hepatocellular carcinoma treatment in the core mode lab with my postdoc Clara Dong under the Vagilis grant. To give some background to my project, hepatocellular carcinoma, or HCC, is one of the most common cancers worldwide. For patients whose tumor is unresectable, local regional therapies such as transarterial chemoembolization are the standard of care, but the average survival rate is only 27% at 5 years. It's hypothesized that an injectable thermosensitive hydrogel may provide a more effective treatment by doing the following: causing ischemia once it gels inside the body, thereby completely blocking blood flow to the tumor, encapsulating a drug and providing its sustained release into the tumor site to decrease tumor size, and providing X-ray contrast for direct monitoring of the hydrogel over time through gold nanoparticle, or AUNP, CT contrast agents loaded in the hydrogel. From prior work, we know that chitosan-based hydrogels are biocompatible and capable of degradation via human enzymes, and that a chitosan polymer and ammonium hydrogen phosphate, or AHP, cross-linker mixture is liquid at room temperature and gels at the body's internal temperature of 37 degrees Celsius. Therefore, in the present study, we aim to answer the following questions. What ratio of chitosan to AHP gels at the ideal rate? The ideal rate being 60 to 120 seconds in the in vivo model, as a faster rate will cause the hydrogel to gel inside the catheter being used to inject it, while a slower rate will allow the hydrogel to travel inside the bloodstream. Second, what drug will the hydrogel be loaded with to have higher treatment efficacy? And third, how will characterization of the hydrogel change as it is loaded with AUNP in the drug? To do this, first I mass-produced AUNP in the lab and tested its viability. I also tested its concentration using ICP-OES. Then I did a search to determine which drug would best be used, and ended up deciding that a lactate dehydrogenase inhibitor would be the ideal drug since HCC tumors require that for growth. Then I made a stock solution of the drug of concentration 1 mg per 1 ml and ran several trials of gelation tests in the 37 degrees Celsius water bath to characterize the gelation time of various formulations of 1 ml of hydrogel, which is the amount of hydrogel that will be tested in vivo in the healthy rat model. The formulations of the hydrogels tested were as follows. There were 3 of them: just AHP and chitosan. This formulation was used to determine the ratio of AHP and chitosan that would be used in further testing. Then AHP, chitosan, and AUNP, and this is the model that's going to be tested in vivo, so this one would ideally gel between 60 to 120 seconds, and then AHP, chitosan, AUNP, and the drug. To determine the AUNP and drug volumes needed in the hydrogel, the previous concentrations that were determined were used, and then a literature search found that 8 mg AUNP and 10 micromolar of NHI2, which ended up being the drug chosen, are used in similar in vivo models for contrast and treatment. So then the AHP and chitosan volumes could be adjusted accordingly based on how much AUNP and the drug was used, and then the determined ratios from the chitosan and AHP trials. So the results of the UV-vis spectroscopy, first of all, showed that mass-producing AUNP was viable and yielded viable particles. NHI2 was found to be the LDH inhibitor that reduced lactate production in HeLa cells, so it was the drug chosen. And then the main finding was that as more AHP crosslinker was added to the chitosan polymer, the time the hydrogel took to gel in the 37 degrees Celsius water bath decreased, and this can be seen in figure 2, which shows one trial of gelation time of the hydrogel decreasing with the addition of increased amounts of AHP to 1 ml of the chitosan polymer. Additionally, adding AUNP and NHI2 did not significantly change the gelation time of the hydrogel. Table 2 shows the addition of NHI2 caused the average gelation time to be about 103 seconds, but then in Table 1 you can see that without NHI2 and with AUNP, the average gelation time for the same trial is still 103 seconds. So gelation time can be increased or decreased depending on only the ratio of HP to chitosan, with more HP leading to faster gelation time. The formulation in red in Table 1 is a formulation that will be tested in vivo in the healthy rat model, and the weight ratio of this formulation is 0.125. Moving on to the figures, in figure 3a we can see, and b, we can see the hydrogel in its liquid and solid form being after it has been put in the water bath, and figure 3b shows the hydrogel when AUNP has been added, so that's what gives it the darker color. So in our future work, we will first of all test to confirm that there's no significant effect on gelation time with AUNP and NHI2. We'll do a cell viability assay on the HO7 cell line, which is a liver cell line, to test the cytotoxicity of NHI2 to those cells, and then do the in vivo testing in a healthy rat model as well as a diseased rat model to see the hydrogel's contrast capabilities and confirm the gelation time, and then also do a release testing of the drug at this time. Thank you.